Now we're going to consider the creation of a model for arterial blood pressure based on a differential equation that can be used to diagnose or perhaps characterize different levels of heart function for normal people versus, say, athletes. And so we're going to start with just looking at the function of the heart as indicated in this diagram. And then we'll eventually get into looking at some parameters that'll help us define the blood pressure and then get into the specifics of the mathematical equations. But right now we have a picture of the heart, as you can see right here, and it's a cutaway section. So we're pretty much interested in the flow of the blood and the interaction of the blood between the lung and the heart, the lungs and the heart. And so typically what happens in pulmonary circulation is the blood is going to flow into the from the body into the heart into the right atrium. That's this part right here. So it's from your perspective, it's your right. So this is the right atrium of the heart. And so the blood is coming from the body, from the anterior vena cava, so forth, into the heart in this section right there of the heart, the upper atrium there. And then it moves through this atrioventricular valve into the right ventricle down here, so that blood is then pushed and pumped up through into the pulmonary artery right here to the lungs. So there can be a gas exchange, so that the blood exchanges the oxygen for the CO2 in the lungs, and then coming back from the lungs, you have that oxygenated blood coming in to the pulmonary veins. So that's coming back from the lungs into the heart there in the pulmonary veins. Pressure in a pulmonary vein in the left atrium over here is somewhere between 5 and 15 millimeters of mercury. If you think about when you get your blood pressure measured in terms of the movement of that mercury on that scale, that's typically how that pressure is moved. So typically you're looking at somewhere units between 5 and 15 millimeters of mercury. So again, now for this cardiac cycle, what we have is the blood then flowing into the left ventricle. It's been oxygenized. It's been coming from the lungs right there, and one of the interesting to note is that the pressure in the heart across the different sections or the different ventricles and the atriums is fairly rigid. There's not that much change across the pressure in the different components of the heart. What then happens is the right atrium is going to contract, and the valve between your atrium and your ventricle, again, you see there's two of them. You have two what are called atrioventricular valves. They will close as blood moves from the ventricle to the atrium or vice versa. And so when the right atrium over here is going to contract, it forces the valve to close, and then hopefully the heart will receive an electrical system that causes, for all practical purposes, what's called ventricular contraction or systole. The systole is the functionality of the heart which involves the contraction of the lower part of the heart, the ventricles. Okay, and so the left ventricle over here would then contract. Again, that blood has been enriched with oxygen from the lungs. This would contract and pressure would increase until it blows open the valve for the aorta. So again, underneath here is the valve to the aorta. This oxygen-rich blood that's now come from the lungs is going to be pushed into this the big, very important valve, your largest valve associated with the heart, the aorta here on the top. And that's going to enable the blood to be pushed to all parts of the body. So as pressure rises in the aorta, usually what's going to happen is your atrioventricular valve reopens while the aortic valve closes, and so that the high pressure in the aorta will force that blood into other parts of the body. So you need high pressure up here to get that rich oxygenized blood to all the parts of the body that need it. And of course, as the blood flows out, the aortic pressure would then drop as the blood is pushed out of this the pressure inside that particular valve will drop. That's called systolic pressure. So again, when you have the ability to push the oxygenized blood up into the aorta, you're talking about systolic pressure versus the reduction of the pressure after the blood has already been pushed out of the aorta. That's called diastolic. And again, we'll look at those details in just a second. So this is just basic functionality of how the heart works. And what we're going to look now is how to model blood pressure that would exist in your arteries using these different phases of pressure that we just talked about. So I'm going to move the diagram off to the side. And so what we're looking at is the idea of what we'll call modeling arterial blood pressure. And I'm going to write BP to represent blood pressure. So what we really want to do is model, again, the arterial, meaning it's only to do with your arteries, the arterial pressure, we'll define that as P sub AT, seems like a reasonable representation, A for arterial, P for pressure, and with the fact that it changes through time, the right is a function of time. And we're only interested in modeling this arterial pressure during a single beat of the heart. So we're interested in knowing how does that change, the arterial pressure that you're going to experience when the heart has pushed that blood out to your arteries. How does that going to change in time within a single beat? So some other parameters that are important to build in this model are what we'll call cardiac output, and we will use a particular variable name for that. We'll call it Q. And what cardiac output would represent, it represents the average amount of blood I'm going to abbreviate amount of blood pumped by the heart. And it's important to look at units. Building this model, it's very important to make sure that there's consistency in the units. And so the units here would be liters per minute. Cardiac output, how much blood can you pump out given a particular time unit? So in this case, we're going to look at liters per minute as a representation of cardiac output. Another important parameter in building our model of arterial blood pressure is what's called the stroke volume. The stroke volume, write it just as you would think about it, stroke volume, and we'll use the letter V, is the amount of blood pumped by the heart during one beat. During one beat. So you can see the difference between total cardiac output in terms of how much the average amount of blood that you can pump out of the heart in a minute's time versus stroke volume, which is the amount of blood that's actually pumped by the heart during one beat. So it's emphasized during one beat. Okay, and of course, that would be liters per beat. Okay, so then you can sort of get the difference between what the heart rate, the impact the heart rate's going to have on how much blood that's going to be pumped. So it is important to look at the overall time unit. That we'll call that T. T is the duration of the heartbeat. So having done that, then we have an overall relationship between these parameters.